following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, medications. Two experts are here to answer your questions. Now here's your host, Dr. Maureen Hashmi.
Good evening. There's no doubt about it, medications, whether they're prescription or over-the-counter, can be expensive, and it can be confusing to determine what's best for you to take. But the good news is that the right medications can make you feel better and keep you healthy. What are the possible side effects and possible interactions of the drugs you're taking? How do you find the medicine that's right for you? Should you be concerned about the over-the-counter medications such as vitamins and supplements? We'll get answers to those questions and more tonight from our two guests, Dr. Holly Niemannhart, who is a family medicine physician at West Virginia University, and Dr. Charlie Ponte, a pharmacist with the WVU School of Pharmacy and in the Department of Family Medicine. If you'd like to ask our guests a question, give us a call. Our phone lines are now open. Charlie, many people are given generic drugs by their pharmacist, and they obviously cost less. Should we worry about that?
Well, I think that what the public and what the patients, I think, and our listening audience need to know a little bit about is that generics, generally speaking, are as good as brand name drugs. In fact, pharmacies and your community pharmacist has access to a publication that the FDA actually has for them that lists the drugs that are available as generics. And if they're listed in that particular publication, then in fact that generic medication is as good as the brand. And so I think one would be assured that if that pharmacy carries a generic from that particular publication, that it should do what it's supposed to do in terms of manage the condition in which it is to be used.
So you really need to rely on that pharmacist to help tell you whether or not that generic is appropriate for them. Yeah,
and I think I think that's a good point to make, that you have to really rely on the professionalism of the pharmacist, that the proper generic was chosen, to carry, so that when a prescription is filled with a generic, not only is the pharmacist assured that it's going to work, but the patient needs to also be assured that it's going to be of benefit and really not cause anything that's different than even if it were a brand name drug, that the side effect profile would be essentially the same.
Great. Holly, how can patients stay informed about the drugs that they're on and taking?
Well, a lot of my patients today are going onto the internet and they're researching drugs. Many times when you go to the pharmacy, enclosed with your prescription is some instructions, and they list often the reasons for taking the drug, the most common side effects, and that's a good resource as well. Doctors should be aware of I would say we're aware of the very common side effects and interactions, and we try to make sure that we give the correct medications. But the other thing to make sure that we're safe is when you do come to visit your doctor, make sure you tell us everything you're on, including medicines you got from another doctor, as well as anything that's over the counter or even something that you picked up at the health food store, because we need to know everything that's going into the body so we know how it can interact.
So you're talking about herbal supplements and alternative therapies, those kinds of things, vitamins.
Right.
Okay. How about, you just mentioned the internet. A lot of people are searching through the internet now. How safe is that to go through the internet to buy medications? How safe is that for patients?
I don't usually recommend that people go through the internet to buy their medications. I'm originally from Ohio, and I had some people who crossed the borders into Canada to purchase prescriptions because it was much cheaper in Mexico, obviously. I feel much better when the patients are using a pharmacy that I know that has quality drugs. As far as, though, information on the drugs, I think the audience can be informed by just searching their medications and looking for the reactions that it can have in the interactions with other meds.
We actually have our first caller, Mary from Floyd County. Mary, you're on the line. Go ahead with your question, Mary.
I'm very interested in a vitamin. There's many different vitamins on the market. I'm 65 years old. I would like to know one vitamin, which would also include vision. One vitamin.
So she's asking for a recommendation on vitamin.
Well, let me maybe start, Mary, with one of the things that I tend to recommend to patients. One is that if you have a good diet and you're really, frankly, eating 3 good meals a day and your nutrition is really in pretty good shape, then I'm not one who strictly advocates or wants patients to necessarily take a vitamin. Certainly can do no harm, but again, like everything else in excess, or if you take too much of it, it certainly has some potential, harm associated with it. I'm not aware of any one specific brand of vitamin that really can sort of solve all the issues, as well as sight. And certainly as one gets older, I think a lot of older people are worried about macular degeneration, in which case, there are some products that you'll find that are listed in magazines, and other sources, even on the internet, that purport to or may claim that they can really benefit those that may have it or prevent it from even happening. Now, I don't know if there's much research to back that up, frankly, and I think any questions related to eyesight, or if there's any product that might help with that, I would probably direct towards their family physician or their other primary care provider and see if, in fact, what may be going on, and maybe it won't be benefited by taking a vitamin. That I think many times patients sort of have symptoms and signs that they think can be easily fixed with perhaps a medication. And vitamins are medicines, like aspirin even. And so I think before one starts to take things on their own and they may have some physical complaint, they really should see their family doctor or their primary care provider to make sure that they get checked out before they start taking medicine on their own.
On that vein, do you, Holly, recommend that your patients after a certain age start a vitamin, or is there any general recommendation you have regarding that with patients?
I don't necessarily object to a general multivitamin, but I agree with Dr. Ponte. If people are getting a good balanced diet, it's probably not necessary. The vitamins in women, and I would guess by Mary's voice that she might be among those of us who are menopausal, calcium, vitamin D, and a little bit of vitamin C would be my major concerns for her to make sure that she keeps her bones as healthy as possible.
Okay, great. One other thing back to kind of the generics, because I know a lot of people out there have questions about generics. Why is there that price difference between the brand and the generic? What accounts for that?
Well, I think what accounts for a large amount of the price is that the brand name drug company were the ones who innovated the chemical compound, went through all of the testing, the various not only animal trials but also human trials, and of course that you incur costs and a great deal of cost when you do that. In fact, now to bring a drug on the market probably costs hundreds of millions of dollars to bring an entity to market, and by the time that they're actually marketed, their actual patent life is going to be very short. So part of the costs, I think, of development are built into the cost, and then of course in reality, they only have a short time period in which to sort of recoup some of those costs because the patent life will then be expired. And then at that point, when that patent expires, then a generic drug company is able to start manufacturing that. And of course, they don't have all the costs that went into development. So it's easier to create the medicine and to manufacture it, and so the cost is lower. But again, if it's a good generic product that meets all of the FDA regulations and meets all of the standards, then it should really, in fact, be no better, no worse than the brand name. But it does have the advantage of a lower cost, and that especially in 2011, with our economy the way it is, it makes sense for, I think, people to always consider generics first.
It's had the benefit of the trials already been run on the brand.
Right, and they've already had the benefit of all the prior research and development. So they gain the benefit, but at a much lower cost than if it were a brand name product.
Right.
So it makes a lot of sense, I think, to really consider generics for most people.
Great. We have another caller, Kathy from Marshall County. Welcome to Doctors on Call. Kathy, go ahead.
I was just wondering, is there such thing as taking too many vitamins or over-the-counter medications that would interact with other medications such as prescriptions for high blood pressure or heart disease or diabetes or such?
That's a great question because it applies to so many.
It does. Absolutely. And I think probably the thing to remember is that all the medications you can get over the counter, for the most part, were at one-time prescriptions. And especially the medications for pain, such as the Aleve, the Motrins, the naproxens, the ibuprofens, those are drugs that, if taken in the wrong dose, or sometimes even at a therapeutic dose, can really have an interaction with disease processes such as diabetes and high blood pressure. It can also have some effect on your kidneys, and it can also interact with the other medications that people are on.
Yeah, so really important to disclose all of those things that you're using, whether or not it's regular or intermittently.
Right.
Yeah, and just to maybe add to that point, I think it's extremely important for the public that are listening to the show to realize that when they see their primary care provider or their family physician or go visit their pharmacy, I think they really need to bring all of their medications, not only those that are prescriptions, but also their non-prescriptions or referred to as over-the-counter medications. And you know, we call it that sort of a brown bag kind of approach, where the person brings everything into a brown bag and they bring it to their provider so that they can see what they're taking. Because now with kind of the society as it is, where we tend to want to take pills to kind of cure all our ills, the list is growing, and we see that even in our own practice as well with our patients, that the list of medication is growing longer and longer, not only in prescriptions but also in the over-the-counter realm as well. And so there's a great potential for interactions, side effects, and they can even maybe not just cause harm, but they may actually prevent some of the benefits that you may see from some of the medications. So their blood pressure may not be as well controlled, their blood glucose is not as well controlled with respect to their diabetes. So it makes a lot of sense to kind of let the provider know, whoever that may be, what you're taking.
Taking care of them. Yeah, I think especially with supplements, a lot of times the medications go under multiple different names, and sometimes you can be fooled into thinking you're not getting something that you actually are.
I think the other thing that can be misleading is so many of the supplements and things are labeled as being natural.
Right.
And so that kind of leads you to believe that they're not harmful.
Or couldn't be.
But even those can be harmful.
Absolutely. We actually have another caller, Betty from Preston County. Betty?
Yes.
Welcome to Doctors on Call. Go ahead.
Yes. I'd like to know if there's any generic insulin.
If there's any what?
Generic insulin, is that
okay,
right?
Generic insulin.
Betty? Not really. There are only just really a few manufacturers of insulin. There's no generic. I will say this: there are some of the older, insulins that have been on the market for a long time. Regular insulin that folks may be familiar with, or what's called NPH insulin. Some of those insulins, compared to some of the newer ones, that are a little different in their action, may be cheaper than some of the newer ones, but there's no real generic version of insulin that someone can get at a very reduced price. It just isn't possible with that limited kind of drug, product for those who have diabetes and require
How
it.
about other medications that might, over the counter, potentially vitamins, et cetera, that actually might help with insulin resistance? There's other things that patients can take to help with their insulin resistance, maybe? You guys recommend?
Well, that's kind of a very difficult question. Insulin resistance, sort of sets up the person to potentially develop diabetes. And again, as I kind of alluded to earlier, we have all these pills to cure all our ills, but there really is no pill to cure insulin resistance. What is most important, and I'm sure Holly's going to agree with this, is, these people have to follow a limited calorie intake. They got to lose some weight. They got to be active. They got to put on some sneakers, and they have to move, and they have to walk. That's how they're going to prevent diabetes, as opposed to trying to take a medicine that's going to maybe reverse that defect that they have, that predisposition to developing diabetes.
Let's switch gears here. How about antibiotics in terms of overuse? How often is kind of too much?
It's, I grew up in the era where every time I had a sore throat, I got penicillin. And what we've learned over the years is by using antibiotics for things like colds, for things like sore throats, which are many times caused by a virus, we can actually get some of these scary resistant bugs that are around right now. We have very good antibiotics, but I think most of us as physicians are starting to use them sparingly. And for example, if you come in with, just say a sore throat and a runny nose, we try very cautiously to make sure whether it's a virus or whether it's a sinus infection that might require an antibiotic. And there are many things that our bodies can fight off on their own. And what we'd like to try to do is save those antibiotics for the infections that really need them. Yeah.
Right. We had a caller who had some questions about fish oil. When do you recommend that patients take fish oil, and how does that work?
Well, I think it again, you got to be a little careful with fish oil. You know, it really is used to treat people that have blood fat problems. They have high cholesterol, and for lack of a better way to really say it, and I think that fish oil becomes an option sometimes for patients who, for whatever reason, they can't tolerate some of the prescription medicines that are available to treat, you know, the high lipids that the person may have. And so fish oil really does have a place, and it really does work. The problem with fish oil is that there are so many products, and they're not all the same. It's difficult to kind of give any recommendation for one in particular. Again, I think one needs to really talk to their family physician, talk to their pharmacist, and see what they carry that has really been of benefit to that patient group. But again, as I think one of the other women, earlier caller, had indicated, you know, there can be, if you overtake it, if you overuse it, it has a potential to affect the way your blood clots. And if you are also taking medication that also, let's say there's a drug that many people may know about called warfarin or Coumadin, which basically chemically makes your blood take a little bit longer to clot, used for various conditions. But if they take a lot of fish oil, there may be some interaction that could take place where now it takes a little bit longer and longer to clot and puts the person at risk to bleed. So fish oil is relatively safe, but under certain circumstances, it could be a problem. And some of the products I know from the standpoint of the patient may not like it because it gives them a fishy taste. If they burp, they can taste it. It may be somewhat distasteful for people around them, you know. So you got to be very careful into which ones you pick and choose. But so they can be a benefit, but they also
have some drawbacks.
Have some drug interactions that you got to be careful with.
Holly, do you find that it's more helpful when you use your fish oil in the patients that have high triglycerides rather than high cholesterol? Do you find that it helps those patients more?
A lot of times it does seem to help with that. In my practice, I tend to use the fish oils as an add-on to some of the other medications, or in people who just can't tolerate things like the statins, which we use kind of first line for cholesterol treatment.
Great. We have another caller, Wilma from Wayne County. Wilma, go ahead with your question.
Yes. I am anemic, and I've been taking ferrous sulfate for a while. Is it where it's so hard on your stomach? Is it okay to go off of it for a while and then start back on it? If so, how long should you go in between?
Well, could I ask what dose you're taking, if I may?
It's 5 micrograms.
5 micrograms?
Or 5 DR, I guess that's micrograms.
Or it's probably grains, maybe?
Could be.
Which would be essentially like a aspirin tablet, 325 milligrams, and that's a low dose. It's funny, a lot of patients just can't tolerate any dose of iron, and it bothers their stomach. So one of the things, the first thing to try is take it with a little bit of food, okay, and that could help. If not, then there are some products now that kind of release the iron outside of the stomach. More into the small intestine, and sometimes that could help. Now, I will say this, it's a little more expensive too, but there are options for people, you know, and I guess it depends on how anemic, and if now you're better with the iron tablet, wherein you may be able to safely come off of it for a while, and then maybe restart it with a different product if the physician or primary care provider feels as though that the blood counts are starting to drop, then you can reinstitute the iron. And maybe a different product would be best for that person. But there's no way to predict what people are going to really have a problem with their stomach with iron, and those that aren't. And
the trial by fire is what you're saying.
Or trial by iron, I guess.
And so if they take, we always talk about taking some sort of vitamin C, orange juice, something to help with the absorption. Does that tend to give them more gastritis, taking something that's acidic with it, or do they tend to do fine with that?
Let me perhaps comment in two ways. One is that orange juice can cause stomach upset because of the acidity, and that some people don't like it for that reason. The other issue is that there's been maybe kind of a wives' tale to some extent about whether or not giving vitamin C with irons has a significant effect on iron absorption. It has a modest to small effect, but it may not really give you as much as you think, in which case, especially if the person gets more of an upset stomach with the vitamin C, then I would say eliminate it and then kind of go the route of maybe changing the product. So vitamin C may or may not really be all that much help.
Okay, we actually have another caller, Dorothy from Fayette County, Pennsylvania. Go ahead, Dorothy, with your question.
Hi, my question is, I take high blood pressure medicine, and if I eat grapefruit, will that affect it in any way?
As far as the interaction with grapefruit does have an interaction with many medications, and really without knowing exactly what you're on, it would be hard to say. But with a lot of the prescription medications, often I would say you're better off to probably avoid the grapefruit or the grapefruit juice.
Are there any specific medications that it's a contraindication or really not recommended that you take grapefruit juice or eat grapefruit with? Anything that specific?
I mean, there are a list, of medications that your physician or your pharmacist should have available. And the list is really longer than what I have in my head, frankly. But, there are some that it really could be an issue where you can affect the ability of that medication to really help the person or lead to maybe an adverse effect. So I think whenever it comes to grapefruit juice, I think you have to kind of, screen what medicines the person is taking, how much grapefruit juice you're taking, and then see what the ultimate effect may be. And if it's significant, then you either avoid the grapefruit juice, but if the person refuses to, not stop drinking grapefruit juice, then you're kind of stuck, and now the provider has to come up with an option that maybe can still treat the condition, but allow the person to have their grapefruit juice, So.
We have another caller, Lorraine from Cabell County. Go ahead,
Hello.
Lorraine.
Hello. I have systemic lupus, and I'm 50, and I'm going through menopause. And I've noticed I already have sleep disturbances, but since I've gone through the menopause, they're beginning to be worse. Is there anything that I can take without going on an Ambien or something like that would help with the sleep disturbances? I already do the relaxation techniques and not drinking caffeine and things like that. But is there anything over the counter that would help?
We only have a couple minutes. Holly, you want to take that one?
That's a hard one to say. There's a lot of things that can be used, but many of them can have interactions with your prescription drugs. A lot of times environmental things, such as a cool room, using a fan, wearing light pajamas. But unfortunately, the menopausal years for a lot of women, even without the other problems such as lupus, are just a miserable time. Probably the best bet would be to sit down and go over all your medications and all your symptoms with your family doctor and see if you can work something out.
Sometimes even just over-the-counter Benadryl can be helpful for some of those patients. They can talk about estrogen, obviously, because it is an estrogen deprivation problem when you can't get to sleep or can't stay asleep. So I think that'd be a place to probably start. Like you said, make sure that you're not on anything that's inducing those symptoms. Any other last couple minutes here, wrap-up suggestions or thoughts? We only have about a minute.
Yeah, I think that, when it comes to medications, I think you got to make your pharmacist your friend. You got to make your family doctor your friend. And I think what you need to do is anytime a question arises as to whether or not I should take, let's say, a non-prescription or an over-the-counter medication, I think you need to consult, with that person, with that provider, and you need to always bring your medications in whenever you visit your family physician or other, primary care provider, so that one is always sort of has knowledge as to what you're taking, and that can really influence whether or not a specific new medication may be added to that person's, regimen. And so I think the public really needs to be informed, but your providers also need to be informed as to what you're taking.
Absolutely.
And I guess also be careful of supplements.
Right.
Okay, well, we've been talking about medications with Dr. Holly Niemanhart and Dr. Charlie Ponte. Thank you both for being with us. If you'd like more information, please talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. Maureen Hashmi. Good night and good health.
Join us again next week for another edition of Doctors on Call. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.